Um, Thank you, Phoebe. We have the highest registration we've ever had for a power hour. So this is clearly a very sought after topic. And we're really excited to have Michael Cahill from MDAR, and I'll let him introduce himself in a moment. In the meantime, we decided to do a meeting versus a webinar. I personally prefer the meeting so that if you want to come off mute, it's a little bit easier to ask questions, but please try to stay muted throughout the presentation just to avoid distractions. We will post the slides and a recording of this training on our Training Hub website and the Western Mass Public Health Association website, which I will put all of this in the chat. And we will send CEUs in the next 1 to 2 weeks. It takes us a little bit of time to make the certificates, and we'll upload them to a Google Drive and we'll send you that link. We got one CEU for Mass CHO, Mass RS, and then the NEHA registered sanitarian as well. The slides should take about 25 to 30 minutes, so we're going to have plenty of time for questions at the end. So feel free to put your questions in the chat as they come up, but we'll most likely address them all at the end. So that's all that I have for now. I'm going to start sharing my screen. And Michael, if you want to introduce yourself to everybody.
Sure, thanks. Just confirm you can hear me all right. Somebody give me a nod. All right, we're good. Good afternoon, everyone. I'm Mike Cahill. I am the Director of the Division of Animal Health with the Massachusetts Department of Agricultural Resources. I've been with the department for 32 years. I started out as the rabies program coordinator under the Division of Animal Health, which resulted in a lot of communication with animal inspectors, animal control officers, and boards of health. We work together responding to both domestic animal interactions with wildlife and domestic animals that bit or attacked humans or other domestic animals. Those communications frequently included somewhat related questions like nuisance or dangerous dogs or livestock fencing, issues at petting zoos, just about any scenario you can think of that involves domestic animals. So one thing that I learned along the way was that I don't know is a perfectly good answer to any question. It's succinct and in a lot of cases 100% factual. So I've always tried to serve as a resource for people for information. But if I didn't know the answer to a question, I was comfortable saying so and then did my best to try to find the correct answer. So this led me to sorting through sort of all of the, trying to understand all the laws related to animals and the authorities assigned at the municipal, state, and federal level. About 20 years ago now, I was promoted to director of the division. The division's primary responsibility is preventing the introduction and spread of infectious disease among domestic animals. And that includes pets as well as livestock and poultry. Animal welfare is equally important in controlling disease because animals that are not adequately cared for they get stressed out. Stress suppresses the immune system, and animals with a suppressed immune system are more susceptible to disease. So animal health and welfare go hand in hand, and that is something we keep in mind as we do the work that we do. Just to give you some background on the division, there are 21 of us at the Division of Animal Health, including myself, the state veterinarian and an assistant state veterinarian, and then 10 animal health inspectors that operate out in the field, and 8 office staff who handle the program coordination and administrative support. So we cover the whole state, including the islands, so we are stretched quite thin. And as the only state agency with any authority over domestic animals, we have become the repository for all inquiries related to domestic animals, for better or worse, I suppose. Some of the topics we'll talk about today are not necessarily under my department's authority, but we'll talk about the officials or agencies at the local, state, and federal level who may serve as partners in responding adequately to complaints or concerns related to domestic animals. And maybe, to some extent, some stuff related to wildlife as well. So let's start by talking about some of the key players at the local level. If you want to go on to the next slide for me. So what is an animal inspector and what is an animal control officer? Some people use these titles interchangeably, but they are actually very different jobs with very specific and separate authorities. But just to confuse the matter, in a lot of municipalities, there's actually only one person performing both jobs. So I understand the confusion, but it is important to understand that when they're serving in those individual roles, that it is under different authorities, different sections of the law. So the animal inspector is a town employee, and they're nominated by the municipality to assist MDAR with certain responsibilities under Mass General Law, Chapter 129, which is actually titled Livestock Disease Control. And although these statutes are titled Livestock Disease Control, the language within the statutes applies to all domestic animals, everything from cats to cattle. The animal control officer, on the other hand, is also a town employee, and they are designated by the town to enforce sections of law under Chapter 140, which primarily relate to dogs. We think of the animal inspector position, the inspector, as eyes in a signature. They basically observe and report. And we sort of see that as like a hands-off position. The animal control officer, who enforces the laws that include capturing and confining loose dogs, they have equipment and training to handle animals. We refer to that more as a hands-on position, if that makes sense. So next slide, please. So I said the animal inspector is nominated by the town, and that's either going to be the Board of Selectmen. Sorry, okay, thank you. Animal inspector is nominated by either the Board of Selectmen or the Board of Health, and the decision as to which agency does that is actually up to the town to decide. The two major duties that we rely on the animal inspector. Let's see, thank you. Two major duties that we rely on the animal inspector to perform are the issuance of any rabies quarantines, like for domestic animals exposed to possibly rabid wildlife, or domestic animals that have bitten or scratched humans or other domestic animals. Because of the risk of rabies, we want to make sure that we've covered any potential exposures to try to prevent the spread. There are thousands of these incidents that occur every year, so there's really no way that my 12 field staff could ever keep up with that demand. So it is essential that we have the assistance at the local level to do this. And it is a critical public health measure. So the division does have a dedicated rabies program coordinator that's there to support municipalities in these efforts. The other major duty that, the other major duty that we ask the animal inspector to do is the, sorry, I think I jumped ahead on my own slides. All right, here we go. The major duty that the animal inspector performs for us is the annual livestock inspections, which we do each fall. The purpose of these inspections, the purpose of the inspections is to ensure that livestock and poultry appear to be healthy and well cared for. The reason we call that animal inspector a hands-off position is because they may come across animals that appear to be affected with infectious or contagious disease. We don't want the inspector to be the one responsible for spreading disease from farm to farm. So they need to be taking appropriate biosecurity measures like wearing booties and disinfecting footwear between stops. And the key is that they are close enough to observe the animals to confirm they're healthy, but far enough away to avoid any unnecessary contact so that they're not dragging potentially infectious material around as they go. So when they conduct these inspections, assuming the animals look good, we just make sure they have access to clean water, fresh food, and have adequate shelter, which again goes towards their making sure the welfare is adequate and they're not getting stressed out. If all of that is in order, we're just getting a head count of each species on the property. And we collect this information so that we can develop and improve our emergency response plans. We had some sort of widespread disease outbreak, it would be essential to know where all of the susceptible species are located so we can more efficiently deploy the limited resources we have available. Now, it's important to remember that these data are not subject to public records requests. As part of our emergency preparedness documentation. There is a specific exemption in public records for that stuff. And in some ways, the assurance of confidentiality is what provides inspectors with voluntary access to people's properties to get this information. So it's important for us to maintain that relationship and assure folks of that confidentiality when we're doing those inspections. Now, having said that, if there are concerning conditions found on a property that need to be addressed, we do instruct the animal inspectors to file some sort of a supplemental report so that information can be shared with other officials or agencies as necessary who may need to deal with that problem to get it resolved. All right, next slide, please.
There's a little bit in the there's a little lag when I'm changing slides, so I'm not ignoring you. It just takes a second. Okay, there we go.
Thank you. Okay, so the animal control officer's duties are outlined in Chapter 140 of the general laws. And again, they relate primarily to dogs, which includes dog licensing, rabies vaccination requirements. The ACO also works cooperatively with municipal clerk to conduct kennel inspections and allows the clerk to issue kennel licenses. They are also responsible for picking up any stray dogs running loose. Strays need to be held in a safe and sanitary location for at least 7 days to give an owner the opportunity to find and reclaim them. During that 7 days, the ACO should be actively attempting to locate the owner by scanning the dog for a microchip and checking the license list for any dogs matching that description near where the animal was found. And we're also encouraged then to use, social media to try to reach out to an owner who's attempting to locate their lost pet. So ACO may also need to conduct investigations into dangerous or nuisance dog complaints, like aggressive dogs or complaints about excessive barking. Those complaints, and I think I'll mention it later, the complaints need to go to the select board or whoever it is in the town that serves as the hearing authority, but the select board in turn may ask the ACO to go out and conduct an investigation, collect their own facts that would be helpful in pursuing that hearing. The ACOs may also be the first responder on any animal cruelty complaint. And as I'll explain in a minute, the animal cruelty laws in Massachusetts are actually criminal statutes. So those actually have to be pursued by the police, which most ACOs are not. So although they may be the first responder and the first to go to the scene, if what they're observing appears to be an animal cruelty situation, that investigation must be elevated to the local police or law enforcement officers at the MSPCA or the Animal Rescue League of Boston. And I'll get into that in a little more detail in a bit. But municipalities may also add other duties onto the ACO through their bylaws, like leash laws or a pooper scooper law or something like that. Next slide, please. So what are the statutes that relate to animals? There's a number of different chapters within the general law where animals are addressed. And that does sort of divide up why we're talking about there's different agencies or officials either at the local or state level that may be responding to these different authorities. There's others that aren't listed here, of course, but for our purposes of today's discussion, these are the sections of law that will most likely need to be referenced. A few of these relate to protections for farms and agriculture, but it's important to remember that there's no explicit exemption or immunity for farming or agriculture. Farms still have to be responsible operators, and I'll clarify what that means as we go through these. But you can see here that some of these are at the local level and some at the state level. Next slide. This is probably the worst one you'll see. I apologize for the boring, lots of words on my slides, but just sort of wanted to show you that, the language that I'm pulling from and that I'm using within what I'm saying is coming directly from the statute. So there is law backing up what I'm stating here. So Again, apologies for the boring slides, but it'll get more exciting, I'm sure, as I see a lot of questions rolling in. So it'll get exciting when we get to the discussion part. So 40A, Chapter 40A, Section 3. This is one of the statutes that does protect agriculture, but specifically commercial agriculture. In short, it says a municipality cannot impose a bylaw or ordinance that prohibits or inhibits commercial agriculture under specific conditions. The first condition being that it is commercial, meaning they're selling something produced on the property, and that the property has at least 5 acres or more. But it does also allow for commercial agriculture on properties of 2 acres or more, provided the sales of the agricultural products reach at least $1,000 per acre annually. So technically, if you're just operating a hobby farm or you have a couple horses in your yard or whatever, you're not actually selling anything, this statute doesn't apply. Having said that, the department definitely advocates for people being able to keep and enjoy livestock and poultry for personal use, even when no commercial purpose exists. But the town does have more authority to regulate in those situations to ensure it's done in a responsible way. Next slide. So Mass General Law, Chapter 128, Section 1A is the state definition for farming and agriculture, or agriculture. This definition includes the raising of livestock, including horses, and specifies the raising of poultry, cattle, and other domestic animals used for food. I want to point out one thing on here, the use of the term fur-bearing animals. This isn't actually further defined anywhere under the law, but the department has always interpreted this to mean that the animal is kept for the purpose of harvesting their fur, like wool from sheep, llamas, or alpacas, something like that, and would also probably extend to anyone, raising rabbits or mink or other animals where they're trying to get pelts. And some of those species would actually may require a permit from the Division of Fisheries and Wildlife to propagate. There was a court case several years back where a judge deemed the breeding of dogs to be agriculture. Apparently their interpretation was that that's because dogs have fur. But the department's position has been that unless the person is actually producing pelts to make dog fur coats, they really should not be included in the list of fur-bearing animals. Now, let me be clear that I'm not advocating for anyone to start producing dog fur coats, but we did not agree with the decision in that court case, and there is precedent there. And there have been efforts to try to modify this definition to exclude the breeding of dogs because we do not see that as falling under agriculture. Next slide. All right, so these are some of the statutes that you guys may be more familiar with. MGL Chapter 111, Sections 31 and 155 both talk about regulations the Board of Health is authorized to make. Boards of health and municipalities that have an agricultural commission are required to provide them with an opportunity to review proposed regulations and submit comments. This is important to ensure that there are no unintended consequences, and it's appropriate to consult with knowledgeable people when writing these regulations so you can stay within the boundaries of what's considered to be reasonable. The Agricultural Commission can be a good resource for better understanding issues related to manure management, composting, and other activities associated with agriculture that, folks at the Board of Health may have less experience with. Some municipalities will even write the Agricultural Commission into the bylaws or regulations to serve as a sort of mediator when there are issues within a municipality or the surrounding community that associate with a farm or the operation of a farm. Sometimes they can assist in either trying to educate the farm and improve the situation, or educate the municipality or the neighbors on why those conditions may exist, and that's potentially an acceptable situation. So that sort of leads me into what I have a feeling is probably the biggest reason we had a large crowd today, and that is just a brief discussion on Chapter 111, Section 125A. This section of the law provides some protections to farms from being deemed a nuisance when conducting normal, generally acceptable farming procedures. And I think that's obviously a key phrase. I've heard this part of the law sort of misconstrued by boards of health as a farming exemption, or that farms are immune from being deemed a nuisance. And I don't really agree with that position. Sometimes that happens in a town that has a right to farm bylaw. The right to farm bylaws really are simply an assertion that the town values agriculture in the community. So if someone's going to move into town next to a farm and then start complaining about sounds or smells, that the town recognizes those conditions sometimes come along with the agricultural operations, and that they may be deemed both normal and acceptable. But, Section 125 really does clarify what that means, and it specifies that odors and noise associated with the farm cannot be deemed a nuisance, provided they relate to normal and generally acceptable farming procedures. Of course, normal and generally acceptable can be rather subjective, but the statute does provide a couple of examples for context, like the spreading of manure. It certainly will result in significant odors that can be quite strong for a couple of days, but that is a great way to replenish the soil, and it is deemed a normal and generally accepted farming procedure. We've also come across, you need to include things like the sounds of tractors and other farming equipment, or even sounds made by some of the animals, including roosters, which would be both normal and acceptable. Situations we've come across that we do not consider to be normal or acceptable would include animals wandering off the property into a neighbor's yard or out into the road where they can cause an accident. That is certainly not normal, and nor is it acceptable. Also, if a farm has a sanitation issue associated with feed or improper waste storage or disposal, that has created a pest problem, like rodents or flies that are completely uncontrolled and now spreading into the surrounding community, that's not normal, nor is it acceptable. It's normal for a farm to have adequate food storage that prevents it from being infested with rodents. It's also normal for them to have a good manure management plan. And when they allow conditions to result in pest problems throughout the neighborhood, that really just isn't acceptable. So, the department always advocates for education first, communicating with the operator to explain the problem and asking that they address it may be enough to get things moving in the right direction. But if communication and education fail and the conditions are clearly not normal or acceptable, the nuisance laws may prove to be helpful. Next slide. So Mass General Law, Chapter 129, this is where all of my authority lies. This allows the division to write regulations or issue orders to specific individuals that focus on the prevention and introduction of spread of disease. It grants my staff the authority to inspect animals in the locations where they're kept. This is also where the authority is for the municipality to appoint the animal inspectors, and empowers them to perform their duties at the local level in our assistance. And it is where the licensing requirements are for certain animal-related businesses like pet shops, animal rescue organizations, livestock dealers, horseback riding schools, and a few others. And it also authorizes the division to establish animal import requirements like certain testing or vaccinations to help prevent the introduction of disease by animals being imported into Massachusetts. Next slide, please. Chapter 131 of the general laws relates to wildlife. In most cases, the Division of Fisheries and Wildlife advocates for a hands-off approach. They really would prefer to let nature take its course. In general, ACOs do not have the authority to be handling wildlife, except in very specific situations. Those exceptions are outlined in the Division of Fisheries and Wildlife's regulations. ACOs and other town officials can capture and kill raccoons, skunks, woodchucks, bats, foxes, and other animals suspected of having rabies, including those animals that have basically attacked or bitten humans, in which case they may actually have to be captured to prevent further issues and may in fact need to be tested to determine whether the people or animals that have potentially been exposed are now at risk. I'll note that since the lab does need to look at the animal's brain when they do this testing, animals that do have to be captured and killed and will need to be tested, it's very important that the head is preserved. So in whatever way the animal does wind up getting euthanized, it's important that we're not resorting to a gunshot to the head, because they will not be able to test that animal afterwards. Which this is probably also a good time to mention that, we also want to make sure that municipalities have a good working relationship with a local veterinarian who may be able to assist in these situations for animals that either need to be euthanized or prepped in order to be sent to the lab for testing. The hardest time to develop that relationship is after an incident has occurred and you're pressed for time. So we just suggest that you try to reach out to them now, prior to this, significant need, to see if you can get something set up. And if people are having trouble finding anyone in the area, I would probably refer them to our rabies program coordinator, who's constantly communicating with local veterinarians and may be aware of someone in the area that might be able to assist. So next slide, please. All right, so we talked about this a little bit earlier, the animal cruelty stuff. Chapter 272, Section 77 is the state animal cruelty law. And unlike the other sections of law that I've already been speaking about, Chapter 272 those are criminal statutes. So there's a big difference between civil or administrative law, which gives us our authority to issue fines or suspend or revoke licenses, and criminal law, where violations may result in incarceration. These criminal statutes must be charged and prosecuted by sworn law enforcement officers, meaning police. So in most municipalities, as I mentioned, the animal control officer is not a sworn law enforcement officer. They usually are handling, civil infractions where they can write tickets, but they cannot pursue these criminal charges. So I do recognize there's a handful of towns where this role is covered by a police officer, but it is actually quite rare. So in most cases, the ACO is not capable of doing those criminal prosecutions. So again, if the ACO is coming across a situation they think may actually be animal cruelty, they need to notify a law enforcement officer immediately and allow them to take lead of the investigation. That may be a local police officer, or again, could be law enforcement departments from the MSPCA or the Animal Rescue League of Boston, who have both been given special state police powers by the Colonel of Massachusetts State Police. It's also important to remember criminal prosecutions have a much higher standard of proof and very strict rules for evidence collection. So the crime scene has to be secured. And it's also very important that the suspect does not have their Fourth Amendment rights violated, because if those things aren't handled correctly, it really can get a case thrown out. So we always advocate, if the ACOs are seeing something like that, they need to get a police officer involved right away. All right, next slide, please. So just brief information on some federal authorities that we interact with, who may have some authority over some of the issues that might come across your plate as well. Would include the USDA, FDA, and occasionally the CDC. We actually work quite closely with our colleagues at USDA's Veterinary Services Division. They direct the federal highly pathogenic avian influenza program, or bird flu program. Most of my career, that was only focused on poultry, but over the last couple of years, it started including dairy cattle, which the dairy farms also fall under the Division of Animal Health's purview. Just as an aside, we had a few documented cases of wild birds transmitting avian influenza to dairy cattle in Texas. And since dairy farms hadn't really, in any large part, dealt with a lot of significant infectious or contagious disease issues before, their normal operating procedures did not really include a whole lot of significant biosecurity precautions. So once avian influenza got into the dairy cows, it actually spread to other farms through the movement of cows, personnel they may share, and equipment that they also share. And in a very brief period of time, there were upwards of 20 states that were affected in this outbreak. But luckily, through testing and quarantines, we managed to get a handle on it, and there are currently only 2 states out west that are still having issues. Closest cases we had to Massachusetts, luckily, were Ohio and North Carolina. Our testing has shown that our herds have remained negative throughout the outbreak. So luckily, it wasn't something we had to deal with, but in order to confirm that we are still free of the disease, my guys are still running around on a quarterly basis, testing drawing samples from every farm and sending them off for testing to make sure that we remain negative. So it's other programs that we work cooperatively with USDA on is the garbage feeding permits. That might sound funny to a lot of people. Garbage is actually a defined term in the statutes and federal regulations, and it means food waste containing meat scraps. So there are some pig farmers in the state that may go around and pick up food waste from supermarkets, restaurants, schools, I think even prisons in some cases. And they can use that as they usually aren't having to pay for that stuff. So it is a very cheap source of feed for their animals. But when any of those materials contain meat scraps, both state law and federal regulations require that it be cooked, and in some cases recooked, before it can be served to the pigs. And that is an effort to avoid any potential spread of disease. So in fact, when they're doing this, any location that's accepting those materials, they actually have to be licensed by MDAR and USDA. And we both conduct routine inspections to make sure that they're doing it correctly, and we'll periodically check the cooking equipment to make sure that it gets up to temperature for the appropriate period of time as required by the rules. That brings up another thing. We briefly mentioned food storage earlier, and for farms that take advantage of this inexpensive food source, they may need to take extra steps to prevent issues, as this food may be more perishable than other common feed. Farmers should not be taking in more food than the number of animals they have can eat, and they should be removing and properly disposing of spoiled or uneaten food to prevent infestations with rodents. Let's see. All right. So other veterinary services also has oversight of the livestock auctions. These are the live animal markets where frequently animals are sold off for slaughter. Animals purchased as slaughter only are not allowed to go back to somebody's farm. Again, if they're sold at a market as slaughter only, it is supposed to be solely for the purpose of slaughter, which means that they are killed and slaughtered within 72 hours. My inspectors keep an eye out for identification tags on animals that may indicate they were purchased from the market, because we want to make sure that if they were purchased for the purpose of slaughter, that's done in a timely manner. If people are removing slaughter-only animals and then adding them to their own animals, that causes big problems. The reason that the animals are designated as slaughter-only is because they've arrived at the livestock market without any health certifications, meaning they could have any number of problems. They may be deemed acceptable for slaughter, that they're not a risk in terms of the meat, but the live animal may still pose a threat of transmission of disease to the home herd. So that's why we are trying to make sure that those situations don't occur. Let's see. So as we're mentioning slaughter actually falls under a different division at USDA. That's the Food Safety Inspectional Service, FSIS. And that activity requires both a federal and a state license. The state license is issued by the Department of Public Health in that case. So MDAR has a couple of different joint programs where we share jurisdiction with DPH, specifically their Division of Food Protection. We have a pretty, and both of those programs are actually under FDA. There's a significant food safety program that MDAR has that we share with DPH, and also our dairy program. The sort of the separation of duties is that MDAR usually handles the farm side of production, and then DPH picks up when products are moved to processors, wholesalers, or retailers. And then lastly, we do occasionally work with CDC, who handles international imports of dogs. They're stationed at Logan Airport and occasionally need to reach out to us when something's arrived that may pose a risk, and they want to work with us to make sure we're following up on that animal if it winds up staying here as opposed to being sent back to its country of origin. Next slide, please. So who else might play a role? I mentioned the dangerous or nuisance dog complaints that the ACO might investigate. Statute under Chapter 140 requires a written complaint to go to the select board or whatever entity acts as the hearing authority in that municipality. Only a written complaint to that entity will trigger the investigation and a hearing to determine the status on the dog. We've occasionally asked someone from the fire department to accompany us on an inspection because we viewed something as a potential fire hazard, be it, questionable heating source or something like that. We've also had other situations where the structural integrity of a barn was in question and requested the assistance of the building department to determine if it was safe or not. And there may also be other issues where the zoning board would get involved. So what I can tell you guys is that despite my having done this job for as many years as I have, the one thing I know is to not say, now I've seen it all, because I know that isn't true. There's no shortage of new scenarios that pop up all the time, and none of them fit into a neat box that make it easy to know how to respond. But ideally, when we're working together with our colleagues who may have this authority or this knowledge or that knowledge, we can make progress to improve the situation. So I just want to encourage you guys to stay engaged. Even if it is maybe one of these other entities that has more ability to act, remaining present and available goes a long way in ensuring solutions are lasting. Maintaining those professional connections can really facilitate a good, successful, cooperative response to the next one. So that's all I have. I went a little longer than I thought I was going to. I hope you guys haven't fallen asleep. But happy to try to respond to whatever questions we've got.
We've got some in the chat. I will ask them in order. So some of them have been answered, but we'll ask you anyway, just to make sure. So someone said, I was under the impression that, I might have skipped one. Did I skip one? No. Okay, sorry. I was under the impression that animal control officers were considered to be law enforcement officers in Massachusetts. Does this have any relation to whether or not they can pursue animal cruelty investigations?
I too have heard people refer to animal control officers as law enforcement officers, but they are not sworn law enforcement officers. And the distinction there is basically somebody who has gone through actually, police training and has police powers. The animal control officer does enforce laws like the vaccination law or the licensing, the dog licensing law, but that does not make them law enforcement officers the way we're talking about, meaning being a police officer.
I did skip one. Who responds to hoof and mouth issues or avian flu and culling of flocks or herds?
All right. Well, if I think hoof and mouth, we're talking about foot and mouth disease. Luckily, that is not something we have had to deal with here, but we've had several reports of avian influenza outbreaks within Massachusetts. And the answer is it depends on whether we're talking about wild birds or domestic birds. If it is an outbreak in wild birds, you are referred to report those to the Division of Fisheries and Wildlife. If there's a die-off of 5 or more wild birds in one location, there's an online reporting form on the Division of Fisheries and Wildlife's website to report those incidents to, and they will follow up on those. And if necessary, if it's a big enough issue, they will send out a basically cleanup crew to get all the dead and dying birds out of there, because they simply serve as a reservoir to infect more animals. If they're domestic animals, those reports are specifically domestic birds. Those reports come to my department, and we'll communicate directly with the flock owner, determine if it sounds like there's risk enough that we want to do testing, and we'll send birds off for testing to determine. And though the response is going to be directly from my staff. So if you guys are hearing reports, again, if it's just one bird or 2 birds, it may not be something that anyone's going to get excited about. But if it is you're seeing a large number of birds dying off, then that's something we want to be notified about. And certainly for an owned flock, the flock owner ideally is going to recognize, this isn't just normal. I have some old birds and they happen to die. They know that they've got a problem going through the flock. They're going to reach out to us right away, and we'll work with them to resolve that.
This was my question, which I think you pretty much answered, but can you give examples of some nuisance conditions that are not normal that you have seen boards of health successfully deem a nuisance?
Well, I think that the 2 that I probably already mentioned, I'll state again. Animals that are wandering off of a farm property and getting into a neighbor's yard, or having access to the road where they can cause car accidents, that is not acceptable. Inadequate fencing is something that every farm needs. Not only does it protect the animals, but it's going to ultimately protect the farm from liabilities, because if there are animals wandering out in the road and we've had very, very serious vehicle accidents with large livestock getting in the road, and that's not something you want to be responsible for. So those can certainly be deemed a nuisance, and I have seen towns successfully use the nuisance law in those cases. And I think if there are really significant sanitation issues where it's causing problems with a rodent infestation that's throughout the neighborhood now, those are it's not always going to be easy to track those back to the farm or determine that that's in fact the source. But that's going to be an important part of the investigation to determine. But if someone's really lacking on sanitation and it is causing a problem, then that should be deemed unacceptable for sure.
Someone said, please elaborate on the status of horses as agriculture. A strict reading of the statute seems to say that unless horses are being bred or used for commercial purposes, they are not agriculture. Therefore, backyard horses kept for recreation would not qualify.
I think I would agree with that assessment. It does clarify in the definition that you're either breeding them or there is a commercial purpose, and in those cases, I would think they're talking about probably, but that could certainly include a boarding stable. If you've got horses on your property that you're charging people boarding for, that's a commercial purpose. That isn't a business that needs to be licensed by the department. We don't even, we would ask that the local animal inspector be inspecting those places, but that certainly is a commercial purpose. But yes, if somebody just has two horses in their backyard and there's no commercial purpose, theoretically that does not count as agriculture. You do have to have some business related with it.
Someone just left a comment that Upside 413 offers mediation for agricultural related disputes, primarily in Berkshire County, but they have some program throughout Western Mass. This was another question from me again. Do you ever get requests to do the barn inspections at other times of the year? I remember my animal inspector was resigning and I was like, oh, could you do the barn inspections in the summer before you resign? Is that something we can request of you? Is there a reason they're done in the fall?
Uh, yeah, traditionally the reason they're done in the fall is because it's after any harvest. So if people are raising animals for food, that they may have been sent to slaughter by that point. So what we're seeing is sort of the standard population that's their overwinter population.
Gotcha.
But that's the reason we do it in the fall. And we've not sought to alter that schedule at all. Well, I'll leave it at that. I don't. That's how we've been doing it, and it seems to work well for us. So we're not seeking a change.
So that's not like a common question you get. Um, this is a great question. Can you elaborate on who is responsible for testing costs? For example, animal prep, shipment, under the different scenarios. There tends to be a lot of confusion around this.
Okay, so that's actually outlined in the department's rabies regulations, 330 CMR 10. Talks about the costs associated with testing shall be borne by the owner. So when I say that, if for whatever reason a domestic animal needs to be tested, the owner of that animal is responsible. However, if it is a wild animal that needs to be tested, technically that animal has no owner. And what the regulation says is if the animal has no owner, then the municipality is on the hook.
Okay, so a bat, if you wake up to a bat in your child's bedroom type thing, technically that is up to the homeowner to pay.
No, because they don't own the bat, right?
Oh,
If,
okay.
if
They own the child.
right,
That's what I was
they
thinking.
own the child. So
Okay.
the
Interesting.
bat should now. I say that, but please realize that there is no cost for the test at all, right? The Department of Public Health does not charge for the test. The costs incurred are really if the animal has to be euthanized, specimen prepped, and then shipped to the lab. So we've not designated that be done in any specific manner so that municipalities have some freedom to find whatever works best for them and can be done on the cheap. So it's that again, if it's wildlife, the town's got to make sure that gets sent in.
Okay. Uh, can a farm that raises poultry to sell make the town get a warrant to inspect that farm?
Yeah, I think it's fair to say anyone can make me get a warrant to inspect that farm. None of us have the right to enter a property without the owner's consent. That's their Fourth Amendment right, and we need to be careful not to violate anyone's Fourth Amendment right. So they can deny entry. Now, there are statutes that provide us with the authority to conduct those inspections. So it may be that if we feel the need to get on that property, I would have to go to court and get an administrative search warrant so that I can conduct the inspection. But I certainly can explain that to the person that if necessary, I can do that. And we try to request their cooperation. And, again, education gets us a long way. If you can explain why you're there and why we need to see this or that, or just confirm that everything's fine, sometimes you can get cooperation. But if there is a valid need to get on the property, there are other ways we can access that property, but we never want to violate anyone's rights.
How have the staffing cuts of health/food safety inspectors and other related personnel at the federal level impacted the work that happens at the state level?
But sorry, can you just, I got lost on the first half of that. What did,
How have the staffing cuts of health and food safety inspectors at other related personnel at the federal level impacted the work that happens at the state level, for example, with MDAR?
well, it's, yeah, we lost quite a few colleagues that had some good institutional knowledge. So it's been a little bit tricky. I'm not sure I've got a planned out response on that one. So I made it's made it tougher. I won't say we've not received guidance when we still request it. But they're definitely more shorthanded than they used to be. And when it comes to us, responding, if we haven't had one as recently, but if we had another bird flu situation on a property and we're seeking assistance, that might be harder to come by under the current situation. But we're making do.
Um, We talked about this earlier when we met, but I'm hoping it's helpful for others. So I see posts in Facebook forums all the time about either there's a raccoon in my backyard, it looks sick, and animal control won't come and do anything. I saw in one of your slides it says the ACO may dispatch an animal on the suspicion that it's sick, but technically they're not legally required to go and like capture that animal and kill it unless there's been an exposure, correct?
That is correct. Obviously, we would still advise them if the animal really does look sick, even if there hasn't been an exposure, it would probably be a good idea to deal with the animal before there's an exposure, because then that avoids the need to test it, which is going to potentially cost the town some money, right? So
Mm.
if you can get the situation resolved without needing to test the animal, that's actually a better situation than waiting for an exposure to occur. Then you have to respond, and then it's even going to cost you money because you got to get the specimen into the lab. So you're right. The law doesn't require that it be done, but we advocate that it may be a good idea to go ahead and do it anyway.
Is there any point, size, business model at which an animal growing operation is no longer a farm?
I'm assuming when we say at any point, we're saying as it gets smaller and smaller.
Larger.
What does it become if it's no longer a farm? If it's too big to be a farm? I guess I'm not really understanding the question.
Phoebe, I don't know if you wanted to come off
I
mute.
think that was just like, is there a certain point at which something is so large as to no longer be a farm in the law, or is it always a farm?
No, usually that 40A Section 3 talks about something that's on a very small property may not be deemed a farm, despite there being a commercial purpose. But I've not seen anything that would limit it based on its large size.
Given the emergent changes in climate, subsequent natural disasters like wildfires, does MDAR require licensed agricultural facilities, kennels, shelters to develop a emergency management and evacuation plan?
Yeah, we've always been advocating for farms to develop their own emergency plans so that, for all sorts of scenarios, whether it's, a natural disaster type thing, or just the manager becomes incapacitated in some way, to have your daily routine written up in some way so that if necessary, someone else can step in and take care of what needs to be taken care of, is an important, plan to have available. And we've been throughout the years trying to work with our partners at MEMA and a number of other agencies, including some non-governmental agencies, to assist in establishing plans should there need to be a significant evacuation because of rising waters or whatever. So we've, through our emergency response planning for disease, we've, made a lot of connections with different organizations that might be able to assist in those other situations. And we keep those connections available. We haven't been doing as much drilling on that stuff recently, but it's still something that's always in the back of our mind. And we're always advocating that farms are doing their own response planning as well, so that, if they can take care of themselves, they're not relying on our limited resources. And if we can take care of it, then we're not relying on limited federal resources. And self-sufficiency is always the best way to go. But when people need help, we do have avenues available for providing assistance.
We've got a few more minutes. I really want to get through everyone's questions, so maybe we can like rapid fire these. This is a great question. Has MDAR seen a significant increase in the complaints regarding roosters? Are they considered exempt as a nuisance if they are on an agricultural property?
So I did mention that I think the sound of roosters would be considered normal and acceptable if it's on a farm. Have we heard more complaints? No, I wouldn't say we've heard more. I think we get a relatively consistent level of them. I don't know that there's more now than there used to be, but I think there's a few techniques just in terms of like if they're closed up overnight, you may be able to reduce some of the crowing either in the middle of the night or early morning. There's a couple of other techniques available. So if someone's really having a problem, I would suggest they reach out to us, and I can have one of our poultry inspectors to see if we can't brainstorm some solutions to try and resolve a problem. But in general, they would not, in fact, be deemed a nuisance. No.
Where can health departments find guidance on space requirements, specifically for poultry? How many birds can an owner keep on 0.5 acres, for example?
Well, that is a good question. So we have a couple of best management guidelines. I'm not sure how specific they are on space, but there's regulations that were put in place, at least specifically for egg-laying hens, that they have to have at least 1 square foot if they have of floor space if they have perches available in a multi-tiered housing setup, or I think it's 1.5 square feet in an open floor plan per bird. So it's not really done by acre. It's really done by a smaller enclosure for number of birds. They've got to have enough room to basically be able to turn around and spread their wings and make normal postural adjustments without bumping into other birds or the edge of the enclosure.
Go ahead.
I was just going to say, there may be some better guidance that we have on our website as best management practices. So we should be able to point to some of that stuff on our website.
I would just note too, some towns it's in zoning, so check with your zoning. Roosters are sometimes included in zoning as well, so sometimes your building inspector can enforce roosters. Okay, let's see. We are a 55 plus community. I just want to know, so it's 3:00 now. Michael, are you okay staying on for like 5-10 more minutes just to get through these? And if whoever's on the Zoom, you're welcome to obviously jump off, but I want to make sure that everyone gets their questions answered.
Sure, I'm fine. I have time.
Okay, great. Thank you. We are a 55 plus community, and a pheasant farm was put right next to us, creating dust, horrific smells, flies, and rats. Sometimes the pheasants escape and roam our park. They advertise that they raise over 250,000 birds. We've been complaining for years and continue to suffer. We have been in contact with the Board of Health to no avail. How can we get our town Board of Health to do an impromptu inspection? Do they need a warrant to go on that property?
If, yeah, as I mentioned earlier, if they may need a warrant if they do not have consent to go and inspect the property. This, again, remember, this may be a situation where we're talking about a right to farm community. As I recall this situation, this sounds very familiar to me, in fact. I don't think that farm all of a sudden showed up next to this neighborhood. I think it was quite the other way around. And it may be a situation where if this is a right to farm to community and the farm was already there and people moved in next door, that may be a situation where they have to recognize that there are certain odors and noises that come along with that. And again, as I've said, if there are issues associated with rodents or other problems, and those can be traced back to the farm, that is something that might be able to be addressed. But sometimes it's hard to determine that that's in fact the source.
Thank you. Just lost my spot. Why are cats not licensed or otherwise tracked? They have to be vaccinated for rabies and would pose a risk if they are outdoor cats and are subject to quarantine if they scratch people or get scratched by animals.
Sorry, can you repeat that?
Yeah, sorry. Why are cats not licensed or otherwise tracked? Like dogs, I guess.
I think they still are licensed in maybe a handful of communities, only like 4 or 5 towns. And they could be, but there has not been a well-supported effort on the state level to require licensing for cats. And bear in mind that, the Department of Agriculture doesn't really write the laws. The legislature writes the laws and then tells us what to do. So it's not something I would necessarily oppose. I do recognize that there have been efforts in the past, and I think I did support them, but we'd have to see what the proposal was before I could commit that the department would have any interest in it. But yeah, I think it's done in other places, and I do know it's done in a few municipalities in Massachusetts, but not quite on a widespread scale as yet.
Does utilizing goats for nuisance weed control fall under agricultural use?
Yeah, goatscaping. Yes, I've heard of that. I think it certainly could. Renting a goat, it can be a pretty environmentally friendly way to control overgrowth. One of the issues, I would say, the only issues that we've really had with it were inadequate fencing at the location where the goats are placed, and if the goats aren't staying where they're supposed to be mowing, that tends to become a problem for us. But I think that it seems like that would be a perfectly viable commercial agricultural enterprise to me. It's just my opinion, by the way.
Within MSPCA, does MDAR have a list of resources to have owners donate or surrender them?
Sorry, donate or surrender what?
I'm assuming animal
I thought
surrender
it was maybe
animals.
roosters.
Oh, good. That's a good point.
We don't have a list of places. I don't have that. That's not something that we have available. I don't know if MSPCA advertises in any way that they accept them. So I know there's a few people out there that do, but it's not something we've been directly involved in.
There's a question up here that I just want to make sure I'm not skipping. Do you happen to know, so when it comes to the cost for the wildlife and strays that go to the lab, and so we're talking like the shipping cost, maybe like the ice packs, all that kind of stuff. Does the CMR get into like if that needs to be paid for by the Board of Health or the Select Board, or is that just something the town needs to work out? Like, does it specifically say it's the Board of Health's responsibility?
It does not get into detail about what packaging or anything is used. I mean, in some cases, the municipality will send the animal control officer in their vehicle, with the specimen on ice in the back of their truck, and then they show up to the lab and hand it off and put it in their fridge. So there's no specific detail on how it's done, but that if there are costs associated with getting the specimen to the lab and tested, that the town does bear those costs.
Michael, I think that this is sort of a rural specific question because many communities don't necessarily have someone who, the drive to the lab is not in our budgets. And so a private veterinarian is generally charging upwards of $300 to euthanize this thing and send it off to you folks. One question was which part of the town is supposed to pay. For small towns that could, 2 of those, 3 of those, and you've busted the Board of Health's budget for the year. Does the law say that? And then you have a second question here where someone is saying that they've always understood that unless there was proof of a bite, they could make the homeowner pay if they see a bat in the house.
Okay, so that second question is important. I want to get to that. But for the first question, no, it does not specify which department within a town is required. It just says the municipality. So however that can be absorbed by whomever's budget is fine by us. Like I said, we tried to leave that loose so that towns could be creative on how it was dealt, so no one was getting sunk. In terms of the second one, they're trying to figure out how to word this correctly. If there is an exposure, either someone's been bitten or direct contact, and we're not entirely sure, whether it's an actual bite wound, but we know they were in direct contact, that is deemed an exposure, and that wild animal should be sent in. Well, I don't think we ever want to be in a position where we're saying, well, first of all, if the homeowner is saying, I want it tested and there is no exposure, it's not a matter of charging them to do it because the lab doesn't even want to test that specimen. If there's been no exposure, the lab does not want to waste their resources testing the animal. On occasion, if we've got a domestic animal where we can't rule out that there may have been human exposures or other animal exposures, they may request that it be submitted so that we can ensure that anyone else that was exposed isn't really at risk. But if we're talking about a raccoon died in my yard, did your dog fight with it? No, the dog didn't fight with it. Well, then don't submit it for testing. It may very well have died of rabies, but it doesn't matter because if we test it and it comes back positive, we're not doing anything different anyway.
I think the in the chat, you probably can't see it, but the reference is to how many people this time of year bring in bats they found flying in the houses where someone slept. Also, I note your colleague Lorraine has her.
So the bat question, bats get tested. No one has, if someone is asleep in a room and there's a bat in the room, they get tested. They are so high risk, they have to be tested. We don't ask someone to say whether they knew it touched them or whatever. If there's a child in the room, there's a pet in the room, someone who may not know whether or not they were touched by that bat, someone's asleep, someone's not quite aware, bats get tested, period.
And though, just to clarify, those directions are directly from the Department of Public Health. Especially we're talking about a human exposure. If somebody wakes up in a room and there's a bat flying around the room, because they were asleep, they cannot confirm that they were not bitten. The species of bats we have around here are so small and their teeth are so tiny and sharp that you could easily mistake a bite wound for an insect bite or not see any injury at all. And as Dr. O'Connor mentioned, those exposures, the people that die of rabies in the US die usually of bat exposures. And it's because the exposure is not recognized. So that's why they take those situations so seriously. So if there are questions about whether or not a bat needs to be submitted based on a human exposure, you can feel free to call the Division of Epidemiology and speak with one of their epidemiologists to confirm whether or not it should be submitted. But in those situations, they're pretty conservative and they're going to want them sent in.
Thanks. All right, I think we're down to a couple more. My zoning bylaws stipulate that the Board of Health determined the acceptable amount of animals on lots in certain residential districts. Is there a resource for determining recommended lot sizes for certain animals?
Again, other than the best management guides that we may have on our website, we don't have anything directly related to a lot size because, you know, what we've recognized is it may depend on the terrain or even the soil as to what's appropriate and what isn't. You know, if you're on a rocky hillside, that might not be a great space for hardly any animals. But if it's 3 acres, that, you know, it doesn't mean it translates. I think each individual property needs to be assessed individually. If that makes sense.
Do property owners who have chickens, roosters on a small residential lot, are they designated as a farm?
Well, I mean, in the eyes of the law, basically everything has to be at least 2 acres or more and commercial in order to be deemed a farm. But if you look at Chapter 128, Section 1A, the keeping of poultry can be deemed agriculture. So whether it's for a commercial purpose or not, you know, that it may vary based on what it is. Like I guess the reason for which it's trying to be defined may depend on which definition it is you're going to use.
Right, 2 more. What should be a resident's recourse if a town declines to cover the cost for testing for an animal that does have a potential exposure? Some residents cannot cover this cost on their own.
So if we're talking about an owned animal that the owner would normally be responsible for, if we do have significant exposures, and it needs to be tested, I would say we need to talk to somebody should reach out to Ashley Kraft, our rabies program coordinator, and see what we can figure out about trying to get it done as cheaply as possible. But if it has to be submitted, we got to find a way to do it. Mm-hmm. But again, if it's wildlife, it's got to be covered by the town. That is not a cost that can be transferred onto the owner. And again, the issue we're talking about is we're trying to save a little money, or we don't have money, that can't figure out where to get the money to send this specimen in, so we're not going to test it. You know, if that represents an actual person being exposed to rabies and then they don't go on and get treatment and they wind up dying, what's the cost there? The liability for that situation is really unacceptable. So we gotta find a way to do it. And again, you know, our rabies program coordinator has been pretty resourceful. If you guys are really having a hard time trying to figure it out, just reach out to us. We'll see if we can brainstorm it and come up with a good idea.
And I think this is the last question. Is the Board of Health required to pay for prophylaxis for positive rabies exposure recommended by the primary care or state epidemiologist?
There's actually a section of Chapter 140 that specifically addresses that. It's Mass General Law, Chapter 140, Section 145A. My understanding is that it said the Board of Health is responsible for covering the costs of post-exposure prophylaxis in any person who is uninsured. So for a brief period of time, most of us were insured. That may or may not be the case anymore. So that may be an issue that comes up, but as far as I know, that statute is still worded in that same way. So if it's an uninsured person, yes, it says the Board of Health is supposed to cover the cost of their post-exposure prophylaxis if it is determined to be necessary.
Okay, and then I think we got one person with their hand raised, if that's okay.
Sure.
Yeah, so I'm E. Dragon, so I'm a nurse by background. Emergency nurse is my strength for a long time, too many years, but that's okay. So, and as far as I know, for Massachusetts residents, if you were underinsured or or uninsured. In terms of the emergency department and receiving care, you can always apply for what's called Health Safety Net, or which is the Mass Health Emergency Insurance, and it can be backdated to the time of treatment. So that way boards of health potentially could not have to do this, cover that care cost. So just an additional resource of knowledge that I know, like Ashley is probably, not probably, I know, like, has so much nuanced knowledge because she is involved in this rabies stuff because that's her primary group all the time. So just wanted to share that along.
Thank you. All right, so I think that's it. I think Kiko just said we could probably have a part 2 on just bats, which I agree. So maybe we'll call you back for another one. But like I said, this is the most we've had signed up in history. So it was definitely a need today. So I appreciate it. Thank you, Michael. And we will post the recording and the slides on our websites and send out CEUs as soon as we can in the next 1 to 2 weeks. So
Looks like Dr. O'Connor wanted to say one last thing.
go ahead.
I apologize, but there was a comment somewhere in the chat that someone had made a comment that the MSPCA officers can go somewhere that like animal inspectors can't, and that's not true. Remember, they're law enforcement. So they, like us, they can go onto a property with permission, or they would need a warrant to go on that property. They cannot go places that we cannot. And as a matter of fact, the bar is higher for them because they are law enforcement. So they have to be really careful about those Fourth Amendment things.
No, I mean, and not to start another subject at the last second, but you know, there are issues with exigent circumstances, but that's a whole different can of worms. So
Thank you both
All right.
so much for all you
Yeah.
do for the Massachusetts. This has been really great. Take
Thank
care,
you.
everybody.
And everyone, anytime I've ever reached out to MDAR, Ashley or Michael, they've been awesome. So if you're ever in a pinch, reach out to them or the on-call EPIs who are 24/7, I believe. So if something happens late at night, rabies wise, I've called them as well. So thank you. And we'll be in touch.